Hey guys, for today's video, I want to talk about reasons why you might want to consider using retinol on the body. When we talk about retinol, the conversation is almost always focused on retinol for the face, for improving the signs of skin aging. But there are a lot of reasons to consider using it in your body care routine. Above and beyond simply improving the appearance of skin aging on the body, there are a variety of skin issues and conditions that might benefit from incorporating retinol. So keep watching to find out what those are. But what is retinol? Retinol is a form of vitamin A. When applied to the skin, your skin can convert it to something called retinoic acid. Retinoic acid can bind to receptors in the skin and help them to mature more efficiently. They also help in suppressing the activation of enzymes that chew up your collagen, and they help stimulate the production of new healthy collagen. They can inhibit something called tyrosinase, the enzyme that leads to pigment production, and therefore they have a role in lightening age spots, sunspots, and post-inflammatory hyperpigmentation. Retinols can also improve skin barrier function by improving the production of key barrier components like ceramides. Retinol differs from retinoids, which are primarily prescription, although there is over-the-counter adapalene, a retinoid to treat acne. They differ from those in that your skin has to convert retinol to its active form, whereas those are already active. So it takes longer to see results with retinol. Retinol also differs in that it's a cosmetic ingredient. So it's not the same as a medication. It's not FDA approved for anything. That doesn't mean it can't work. It just means that there's a lot more variability out there in the types of products that you may encounter. Some you may see really great results with, whereas others you may find are just kind of underwhelming. One of the reasons why I think retinol on the body often gets left out of the conversation is that for the longest time, there really has been a dearth of good quality body retinol products on the market, and that has really changed in the last few years. As a matter of fact, a few years ago, I did a video on the best body products with retinol, and since then, tons of new and excellent products have come out on the market, many of which I have reviewed here, not just body retinols and moisturizing bases, but also serums, masks, even retinol containing body washes. And yes, retinol could be effective in a body wash. A process known as coacervation allows for deposition of the retinol on the skin. But not just in the realm of cosmetic retinols, also in the realm of medications. When it comes to prescription retinoids, I've got to be frank, most of the research on prescription retinoids for, say, acne or really anything have largely focused on the face. That all changed with the advent of the newer prescription retinoid, trifarotene. Check out my video on trifarotene. I explain how it differs in that video, but trifarotene is the drug and the brand name is Acleaf. But coming back to the retinols that we have available in the store to buy for body care products, a lot has changed. I think formulas have improved substantially in terms of retinol delivery. As an ingredient, it's not super stable, but I think with advances in formulation, manufacturers have gotten better and better at creating high quality retinol products. They do something called encapsulation, which allows for protecting the retinol as well as for better delivery into the skin and for protecting it from degradation from other ingredients, and also for cutting down on irritation, because at least in the case of prescription retinoids, it can be pretty irritating. That can happen with retinols. So why might you want to use a retinol on the body? If you have keratosis pilaris and or rough and bumpy skin, rough skin texture, don't underestimate the value of retinol. It definitely can help those conditions out quite a bit, because retinol, once it gets converted to retinoic acid, can help improve the maturation of the skin. Ultimately, that helps to smooth out the skin surface. With keratosis pilaris, it's a dry skin condition where you have a buildup of rough, dry skin cells around the follicle. So retinol helps to reduce that buildup, that dry stuff from building up around the hair follicle, cutting down on the bumps. And it also helps with improving barrier function, ultimately reducing dryness. It smooths out skin texture. With age, your skin can become rough as it relates to loss of the production of good quality moisturizing factors. So retinol certainly can help in that regard as well. Now, when it comes to keratosis pilaris, check out my videos on KP. I have quite a few here. A lot of people, they incorporate one of the ingredients that I've mentioned in those videos that is known to be beneficial. Say, for example, lactic acid. like, an amlactin or whatever. And that helps, but maybe it doesn't get them the kind of control that they need, doesn't quite get them the results. And with KP, everyone differs in terms of what ends up working for them. But in some cases, it can be helpful to incorporate an additional KP fighting ingredient like retinol and or urea. Now, this is not sponsored, but you guys know this year I've discovered a new body retinol that I really love from Gold Bond. It's their Age Renew Retinol Overnight Body and Face Lotion. Highly suggest this as a body retinol. Not only does it have retinol, but it also has urea in it, which is great for improving rough, dry, dull skin texture and improving the moisture content in the skin. Number 2 reason is same reasons you might want to use it on your face, to improve the visible signs of skin aging that happen on our body, especially in sites like the backs of the arms, the backs of the hands, the lower legs. Those are places that see a lot of sun. The backs of the hands, don't forget about those, because not only do they see a lot of sun, but your hands are always being exposed to things that can really weather the skin. And retinol can help in a variety of ways by strengthening the skin, strengthening the underlying supportive framework there, and also helping to lighten the signs of sun damage like age spots. On the forearms and the lower legs, not only do people develop sunspots, but they also develop little white spots that are likely related to sun damage. It's called idiopathic guttate hypomelanosis. Now, retinol is not going to correct that, but it may improve the overall appearance of the skin tone in the background of sun damage. So it's definitely a good ingredient to incorporate to improve the appearance of sun damage at those locations. Also, the neck and the chest. Now, these are areas of the body where the skin is thin and prone to a lot of irritation with retinol and or retinoic acid. So a body retinol may be a better option there, formulated for these more delicate areas. Our face creams with retinol and our face serums, they're largely formulated for facial skin, which is very oil gland dense territory. In contrast, the neck does not have as many oil glands and is a lot more susceptible to irritation from retinol or the prescription stuff. So a body product is formulated to be gentler and maybe something that you tolerate better. When it comes to sun damage on the neck, you get not only wrinkles, but also unfortunately, people who spend a lot of time working outdoors, they don't protect the back of their neck. You can get a lot of sun damage back there. It's called cutis rhomboidalis nuchae. When we see that, it's a clue like, oh, I need to be looking for skin cancers, because that is a sign of someone who has gotten a lot of sun exposure. Retinol is not going to, erase that, but it certainly can improve the appearance of some of that. You'll often get a lot of skin yellowing in those areas too. It's called dermatoheliosis. In skin biopsy, you see just amorphous stuff deep down in the skin as a result of extensive sun damage. But the sides of the neck, the front of the neck, and the upper chest can often develop a type of sun damage called poikiloderma of Savant, where you get reddish brown patches, dilated blood vessels, and atrophy of the skin. Retinol will not erase that, but it can improve the appearance of it. Number 3 is stretch marks. Now, when it comes to stretch marks, do not expect miracles. There's really nothing that can prevent stretch marks. Some people get them, some people do not. Many women develop them during pregnancy. As a reminder, retinol is not safe to use in pregnancy. But people develop them outside of pregnancy, like for example, anytime you gain weight, or if you are into sport, bodybuilding, you put on a lot of muscle, it can stretch the skin very quickly and you can develop stretch marks. Or if you're going through a growth spurt, some kids develop them. A lot of times people might develop them as a side effect from certain medications, namely corticosteroids, but there is some evidence that at least prescription tretinoin applied to stretch marks very early on when they're first forming can ultimately make them less noticeable in comparison to people who don't apply them. So where does that leave you as someone who maybe already has stretch marks? Is retinol going to make a huge difference? Honestly, probably not, because it likely works best early on when the stretch marks are red. It's called stria rubra. But if that's where you're at in your journey, you're starting to notice them, then using a retinol is definitely a good idea. Because retinols help to moisturize and improve collagen, however, they may make the overall appearance of stretch marks less noticeable for you. So still a good reason to consider using a retinol. Number 4 is dark elbows and knees. Now, recently I did a video on this. A lot of people develop dark elbows and knees related to friction on the skin, chronic pressure, like being on your knees a lot or resting your elbow. And in that video, I give lots of tips. And one of the tips is to use retinol to the elbows and knees. Retinol really helps to strengthen the barrier there. And of course, you want to make sure that you are going out of your way to reduce constant pressure on those areas. Retinol also may help in strengthening the skin, making it less vulnerable to leakage of blood out into the skin, which causes something called hemosiderin, which kind of gives the skin almost a copperish, reddish, brownish look, depending on your background skin tone. Reason number 5 is acanthosis nigricans. Now, acanthosis nigricans is the appearance of these dark, velvety, thickened areas of skin on the neck or the sides of the face, but really can happen anywhere in the body. It is a sign of insulin resistance. Basically, insulin-like growth factor is a hormone, and when it's high, it has impacts on the skin, and it can lead to this type of skin thickening. Now, if you have this condition, check out my videos on it. I have quite a few. If you have this condition, it's imperative that you see your healthcare provider to assess for insulin resistance, because that needs to be treated. Regardless, that needs to be treated. And once it's treated, the acanthosis nigricans, it can improve, but sometimes it doesn't really go away. So what can be done? Tretinoin or adapalene, which are the retinoids, actually have been shown to significantly improve the appearance of acanthosis nigricans. Now, you can buy adapalene in the drugstore without a prescription and try it. It may be too irritating for you. That's what a lot of patients end up saying. I tried it, but the improvement was not worth the irritation. They say that with tretinoin, they say that with adapalene. But you might try a retinol. Now, retinol is not as rigorously studied for this, but it's a lot gentler, and you may see improvement with retinol, and it may be something that you're more likely to stick with long term to actually get the results. Probably works by improving the maturation of those skin cells that have been impacted by the increased levels of insulin-like growth factor. Now, another skin condition which we should never expect miracles for, and is not really a problem, most women have some degree of it, and that is cellulite. Cellulite is really an issue mostly on the lower extremities, like the buttocks, the thigh area. Something about the way that the fibrous septae are oriented allows for, in these areas, allows for herniation of fat, and basically kind of looks almost like it's pressing through. And that's what gives that dimpled appearance. I have videos, as a side note, on different cosmetic procedures that can be pursued to improve the appearance of cellulite. One of the tips I often give to improve the appearance of cellulite is try putting on some muscle, because it fills in the space. It's not going to get rid of it, but it can improve the appearance of it. But another thing that can improve it is retinol, because once converted to retinoic acid, it improves the strength of the skin and the structural integrity underlying the skin, at least the deeper layers, to kind of reduce that herniation of the fat and that dimpled appearance. It really can help quite a bit. Again, don't expect miracles, and it takes, like anything in the skin, it takes time to see even a modicum of results. I suggest to anybody who is considering incorporating a retinol for their cellulite, to start out using it and document the process, because that is really how you're going to know if it's working. To take a photograph before and then take a photograph every 4 weeks. As early as 6 weeks, you may start to notice an improvement, but I would keep going with it. Say for example, you bought a product like this, 7 ounces. I would just keep going. If it doesn't cause you irritation, I would keep going with it and document the process until you finish it. And if you don't see any results and you've gone beyond 6 weeks with a product, you may want to give up on it. But it definitely can improve the appearance of cellulite in a subtle way. Again, don't expect miracles. And there's nothing wrong with cellulite, but some people, they're bothered by the appearance of it. Last but not least is post-inflammatory hyperpigmentation. This is more often an issue for those of you who have a deeper skin tone, because basically inflammation in the skin can leave behind a dark mark. And how long that dark mark stays around has everything to do with how severe the inciting inflammatory event was. So for example, acne may have led to it, or a bug bite may have led to it, as well as how long that condition went on untreated. So first and foremost, before pursuing retinol body creams for it, make sure that the underlying condition is under control. If it's acne, make sure that your acne is under control. You're following up with your dermatologist, making sure you're on the best treatments to control it. Once the acne is under control and you're not getting, frequent breakouts, then the hyperpigmentation can be addressed, and retinol can really help clear that up faster by, again, suppressing tyrosinase expression, which is the enzyme responsible for pigment production. And it also helps with the maturation process of the epidermis, and that's going to help with clearance of the hyperpigmentation. So it definitely can help. Is it safe to be using retinol like all over the body? Like at some point you're getting some absorption. Is that of concern? And that's a great point, and something that, at least in the case of prescription retinoids, has always been a reservation for using retinoids on the body for acne prior to trifarotene, which is an acne treatment that can be used on the body because it's more specific to the receptor it binds, and because of that, it is absorbed into the body to a lesser extent, so it's safer to use to larger surface areas. When we're talking about cosmetic products, retinols, the retinol is much weaker, first of all, retinol in general. Second of all, in these body products, the retinol is usually anywhere from 0.5 to 1% strength, sometimes even lower, like 0.25. So it's very unlikely to cause harm. That being said, I don't recommend anyone to use retinol if they are pregnant, especially to large surface areas. Check out my video as a side note on retinol in pregnancy. I also don't recommend people use retinol on the body on areas where you have skin that is open, sore. If you have atopic dermatitis and you develop a flare-up where the skin is raw, rashy, itchy, inflamed, don't put retinol on there. First of all, it'll sting. Second of all, you can get a lot greater absorption. If you have any underlying skin condition for that matter, definitely discuss with your dermatologist, because some skin conditions can be aggravated by retinol. While retinol is generally well tolerated, it can be irritating. Just like the prescription retinoids, it can be irritating. So I do suggest everyone who's considering introducing a retinol to the body to do a test spot of the product first, and then introduce it into your body care routine very slowly, starting, maybe once a week, then increase to maybe a couple of times a week, to every other day, to nightly. Because in the beginning with retinol, you can use it, you might use it every single day and have no irritation. It takes a while, a little bit longer for the irritation to appear with retinol, I find. And so, into week 2, all of a sudden you may be like peeling and irritated. And so you may want to go more slowly with retinol because of that. The other question that I get when it comes to using a body retinol is like, when we talk about using retinol on the face or prescription retinoid, it's always that pea-sized or pearl-sized amount. How much do you need for your body? I suggest roughly a tablespoon of a retinol body product for each limb, like your arm, a tablespoon for your leg. But it will vary a lot depending on the product formulation, the strength, and how well the product spreads on the skin will change up how much you actually need. But you don't need big globs. That being said, it's less likely that you are going to overdo it and get too much irritation by applying a slightly thicker layer of your retinol in comparison to the prescription stuff, where I was cautioned against going on too thick and heavy. It just wastes it and causes too much irritation. That's less likely to happen with the retinol, but still, you do want to avoid using big globs and wasting it. But you'll notice that with these conditions that I've outlined here, reasons why you might want to consider a body retinol. Usually with these conditions, it's going to be just in certain areas. You don't necessarily need to be using retinol to every body site. So if you want to use it for your cellulite, you just use it where you have cellulite, rather than using it all over the place. All right, you guys, those are some reasons to consider a retinol for your body. I hope this video was helpful. We often just laser focus on retinol for improving wrinkles on the face, but it has a lot more to bring to the table, so to speak. Now, if you guys like this video, on the end slide, I am going to link up my last retinol myth busting video, where I answer a lot of common questions about retinol. So definitely check that one out next. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.